Thank you. I'm going to present my student Amir's work on a 4-channel Piezo Transducer based flexible hybrid sensor for respiratory monitoring. So as we know, in hospitals or home care, respiratory monitoring is done frequently because respiratory monitoring can give us information about a lot of underlying health conditions. So it would be actually really nice if we can monitor our breathing pattern in our day-to-day life activities, because then we would be able to detect many problems like sleep apnea, chronic obstructive pulmonary disease. Also, we can assess, like, let's say, athletic performance. So for these reasons, monitoring breathing pattern in day-to-day life will be very useful. So currently there are many techniques that people use, like very easy techniques for respiratory monitoring. One of them, very easy one, is actually PPG sensor, which actually gives us pulse oximetry signal. And by doing signal processing on the pulse oximetry signal, people actually were able to detect the breathing pattern. Another very common technique is also getting the breathing pattern from ECG signal, and there are a lot of like handheld ECG devices available these days. Many groups have also shown that if we can actually mount strain gauges on our chest, we can actually get very good breathing pattern because of our chest movement due to breathing. And finally, also there is a very common technique these days where we measure the impedance on our skin closer to the abdomen region, and then by doing the signal processing on the impedance signal, we can also get the breathing pattern. Now, all of these techniques, they are nice, but they also have some cons associated with them. In overall, like for a wearable respiratory monitoring system, what we really want is we want it to be wearable and easy to use. Of course, we want it to be non-invasive. And the best thing would be actually, instead of like any other biological monitoring, like if we can do some direct monitoring, so by monitoring some organ activity directly, instead of doing indirect monitoring. We also want to develop a system that is low power and has low data transmission rate. And finally, what we really want, if we are using a wearable, we don't really want to hamper someone's activity. So we want the wearable to be working, as we do our day-to-day life activities. So what we really thought, so many of these techniques that like current techniques available like PPG or strain gauges, they are very susceptible to actually human motion. So if you are doing running or if you're walking, the breathing pattern signal you get actually gets affected. So we really wanted to develop a system that is actually, that can be operational under different body motions. And what we really thought is, instead of measuring like biological signals like ECG or pulse oximetry, or even monitoring the blood flow, what if you actually look at some organ motion, that is internal organ motion that is actually sort of a result of breathing. And what we found is there is a muscle around our zone of apposition, which is called diaphragm. And the diaphragm actually moves as we breathe in and out. So if we can actually monitor the diaphragm movement using maybe the ultrasound technique, we can actually detect the breathing pattern. So this table sort of summarizes like some of the available techniques and their associated features. So you can see a lot of these current techniques actually are affected by the movement, and what we really wanted to propose is having a ultrasound technique which works like more than 1 megahertz frequency, and we expected that it will be actually, because we are monitoring the diaphragm movement, and the diaphragm movement is only affected by the breathing. So we expected that it will not be affected by other human motions like upper body movement or walking. So we all know like how ultrasound technique really works. So we basically use sound waves and to use actually, we basically use the sound wave and we get some image of inside our body. So we basically send the sound wave using Piezo Transducer. And as the sound wave travels through our body and gets when it hits some boundaries of different medium, some of it gets reflected and some of it gets transmitted. And from the reflected wave, we can actually get an idea of how the boundary looks like. It's a very non-invasive, safe and painless technique. There are different modes of ultrasounds that are used for imaging. So there is A mode, B mode. The system we developed was a very simple system. So initially we started with one piezo transducer. So we put it on Kapton and on some printed circuit. And we put that piezo transducer between rib 7 and 8, which is called the zone of apposition. So one of the problem we found using one piezo transducer is if we have upper body movement, the transducer can be displaced, and as soon as the transducer get placed on a rib, instead of the gap between the ribs, the ultrasound wave cannot pass through the bone, and we cannot really see the diaphragm movement anymore. So what we've decided to use is then an array of 4 piezo transducer. So even during the body movement, if one of the transducer gets displaced from the gap between the ribs, at least there will be one transducer that can actually see the diaphragm through the gaps between the two rib cages. So that's why we had a channel of, so we had an array of 4 transducer. And then we also designed a mixed signal system. So it actually has 4 parallel channels. And this mixed signal system basically excites all the transducer in the transmit mode at the same time. And then it switches back to the receive mode to get the receive signal at the 4th transducer at the same time. And in the receive mode, it actually basically receives the signal. We designed an analog front end, and so it does do amplification and some other processing, and then it does an envelope detection. And after the envelope detection, it sends the signal, like it basically to an ADC, and then sends to a PC for further processing. And all these transmit, receive mode, and exciting the transducer, all this is actually sort of synchronized through an FPGA. At the bottom here, you can see this is actually the 5-second data that we get from one transducer. And basically, you see that actually when we are, the person has an inhalation, we get a reflection back from the diaphragm, whereas the person has an exhalation, there is no reflection, so all the signal passes through. So it's very easy to actually detect inhalation and exhalation from the received signal. And the transducer that we were using, they had a resonant frequency around 2.2 megahertz, so we excited the transducer at the same frequency. So we actually did several tests on 6 different subjects, and we asked them to do different breathing patterns. This table sort of summarizes our result. Also it shows what we got with a one transducer system. And when we used a one transducer system, we didn't really do intensive body movement. Whereas when you used a 4-channel or 4 transducer system, we asked the subject to do intensive body movement. So you can even see that with intensive body movement, with the 4-channel system, we had better sensitivity, specificity, and precision in the system. We also, while we are doing the test, we asked we actually mounted PPG sensor and like the common techniques like inertial sensor, and we also found the sensitivity, specificity, and precision of those systems. And you can actually see our 4-channel system sort of had a better results than the other system. So here are some results. So when we actually asked the subject to do different breathing pattern, as a standard method for measuring the breathing pattern, we also used a spirometer, so that was our gold standard. So here there are results for 4 tests, where actually in the first test, the subject just did fast breathing, normal breathing, and very fast breathing. And you can see that our sensor could actually detect all these breathing patterns. In the second test, the person actually did shallow breathing, the subject, deep breathing, shallow breathing, and you can see our ultrasound sensor could actually detect those breathing patterns very well. In test 3, the person or the subject was doing normal breathing, but he or she also had very extensive upper body motion. And you can see even with the extensive upper body motion, our ultrasound sensor could still detect those breathing patterns. And finally, for test 5, we asked the subjects to do like breathe hold and long exhalation, and also at the same time, the subject was asked to do some hand abduction movement, and actually our sensor could actually detect those breathing patterns as well. And finally, this is another result where I just wanted to show that when we compared our sensor with other techniques, here actually the subject had different breathing patterns in one test, and while having body motions in different stages of the breathing. And you can see that our ultrasound sensor could actually follow the reference spirometer very well, whereas the PPG sensor, there are 2 techniques to monitor breathing from the pulse oximetry signal. So the baseline technique couldn't really detect anything. The HRV signal, for some stages, it could detect the breathing. However, the HRV technique doesn't really work for elderly people, and it doesn't really work when someone has a breathe hold or long exhalation. And also same thing with the inertial sensor. If you have a very high, extensive body movement, then they get affected by the body movement. So finally, this is actually the system, the mixed signal system that we currently used, and you can see it's quite huge. So since we got pretty good result with the system, now we are trying to basically minimize the system in a 4x4 centimeter design, so we can actually make it a real wearable device. So that's pretty much it for my talk, and if you have questions.
Thank you. We have time for one question. Any? So I have one question specifically on the fact that sometimes, for example, for ultrasound scan, you need the index matching gel for the skin. In this case, you need to use some specific index matching gel to do, to optimize the performance. All right, but that's a liquid kind of pasty, right? Can you? So standard index matching gel, for example.
Standard is ultrasound gel, but there could be like baby oil or other stuff that could be also.
That will work anyway.
Yeah.
Okay.
We also tried with like baby oil, and it works just fine. Even the water works very well. This ultrasound gel, I think, is very similar to water.
Right. Okay. Thank you. Right. So let's move on. Let's thank the speaker again, and let's move on. So our next speaker is Bino